honored Ministry of Health representatives, our students, and all of global surgery enthusiasts and future surgeons all around Africa. It's our pleasure tonight to welcome you in this forum. We have tonight over 300 participants from 20 different countries, from the Sahara deserts of Libya and Sudan to the savannah of Kenya and Senegal, and our great guests outside of Africa, from Malaysia up to the United States of America. Welcome everyone. My name is Zinzar Ibrahim, a final year medical student at Jazeera University, and I'm serving currently as the president of Jazeera Student Surgical Society for the year 2020-2021. It's my privilege to have the society and the organizing committee to welcome all of you tonight. We're delighted to have you with us to participate and share your thoughts in our first annual African Forum for Global Surgery. In this forum, we not only celebrate the global surgery, but also we celebrate the International Day of Africa at the 25th of May. We in Jazeera Student Surgical Society are committed to provide opportunities that enhance surgical learning at all levels and to promote for global surgery and community outreach. In this year, the forum, our theme will be to enrich your global surgery knowledge, and I hope that you would benefit the most from our forum tonight. We are honored to have you all tonight, and we are very honored to have our keynote speaker. And before I go to that, I would like to give a shout out to all of our partners in session Libya, in session Nigeria, in session Ghana, in session Rwanda, in session Somalia, in session Egypt, and in IAS. I would also like to thank all of our organizing committee here in JES. So, our keynote speaker will be Mashkoor Isa. He's a medical doctor with a passion for global surgery and global health. He's currently undergoing a Master of Public Health degree at the University of Sheffield. He served as a youth ambassador at the European Cancer League, where he advocates for cancer prevention in the line with European Code Against Cancer. Additionally, he's an executive board member. He served as a vice president of the External Affairs for Incision, the International Student Surgical Network, an organization working towards the goal of access to safe surgery, timely and affordable surgical care for all, in addition to universal health coverage. So please be welcomed. His efforts needs no introduction. So prepare yourself to be challenged, excited, and inspired. And before I hand over to Dr. Mashkoor, I would like to welcome you all again, and I would like to wish you a very great journey with us. And as Dr. Roy says, let's go fishing in the global surgery waters. So, Dr. Mashkoor, the stage is yours.
Thank you very much. Could you please enable me to share my screen?
Okay, just give me a moment.
All right.
Can you try to share now?
Okay, yeah. Just a minute. See my screen?
That is it now. But some of people are just, I'm a consultant, I can't start posting, I can't do this thing, or start to do. No, I don't care. They know me when I was in Nigeria. I say, I don't care where you are from. I don't care whether you are people. I don't care whether you are.
Hello? Am I audible?
Yeah, we can see it now.
Okay.
Go ahead.
You know, I don't care.
All right.
My only in
Hello, everyone.
also boy from Kano. The boy is
Do you mind muting? I can hear some background noise.
different.
All right. Hello, everyone, and happy Global Surgery Day to you all. I hope you're all excited for this forum as it marks the celebration of Global Surgery Day. It was marked yesterday, but it extends throughout this week. And it's a pleasure to be with you all today. My name is Mashkur Isa, as was previously mentioned. I'm the Vice President of External Affairs at Incision Global, and I'm here to give you a brief overview on global surgery and kind of inspire you and hopefully motivate you to do more and get involved with global surgery. So to start off, we will go a little down memory lane, back in history to 1980 in particular. So back then, as far back as 1980, the then WHO Director General, Dr. Havdan Mahla, he mentioned the vast majority of the world's population has no access whatsoever to skilled surgical care, and little is being done to find a solution. So according to him, lack of access to surgical care was equals a manifestation of social inequity. We know that surgery has been referred to as the neglected stepchild of global health. And this was mentioned by Dr. Paul Farmer. And actually, anesthesia has fared even worse, is described as the invisible friend of the neglected stepchild. But why? It was deemed as too large an investment because it will bring little benefit. But this is because surgical care is typically considered as too complex, too expensive, or having too limited a role to play in treating the global burden of disease. However, evidence has shown otherwise. Evidence has shown that surgical care saves lives and it also saves money. We all know that surgical management, it forms a component of the care of a broad range of treatable diseases, and this represents about 30% of the whole global burden of disease. But it can span from every disease subcategory, yet it remains out of the reach for millions of people, particularly in low middle income countries. While there are estimated 266 million operations performed globally every year, they are highly restricted to high income countries. Now, those in low income countries, that's the poorest third of the world's population, will receive just about 3.5% of all these operations. Yet the need for surgical provision has been shown to vary between regions, where areas such as the Western Sub-Saharan Africa having about maybe 5,626 unmet surgical need per 100,000 population. This is quite an alarming figure. And when you compare it to Australian or Western Europe, they don't have these figures for unmet needs. So many surgical subspecialties have begun to demonstrate substantial variation in unmet surgical need within their fields. And this is particularly in LMICs. So we have neurosurgery, we have pediatric surgery, we have anesthesia, and also from the obstetric point of view, cesarean section is the most commonly performed surgical operations around the world. But despite this, the greatest burden of maternal mortality is in LMICs, and there's limited access to safe surgery, timely access to surgery, particularly cesarean section. And this hinders a lot of complications that happen. But even when the surgery is available, there's still high maternal deaths. Around the world, 1/3 of the babies born in the settings will also die. So we see timely access to cesarean section is required for safe childbirth. There's a huge unmet need for surgical care worldwide. So what is global surgery? According to the Lancet, Global surgery is defined as an area of study, research, practice, and advocacy that seeks to improve the health outcomes and achieve health equity for all people who need surgical anesthesia care, with a simple emphasis on undeserved population and populations in crisis. So it uses collaborative, cross-sectional, and transnational approaches to achieve surgical anesthesia care. But is this enough? We have seen that back in 1980, when the DG mentioned that something had to be done. Sorry? Hello?
No, you may proceed. That was a mistake.
All right. So what does this mean? It just typically means that global surgery is a multidisciplinary field.
Just a lot of white.
Host, is it possible to mute? Thank you very much. We can see that global surgery is a multidisciplinary field. It aims to provide improved and equitable surgical care for everyone, and it encompasses multiple aspects that surround the treatment of surgical diseases and its equitable provision across health systems globally. So it's right from defining the role of the need of surgery, all through identifying barriers to implementing surgery. Global surgery has a very expansive remit. So it must engage a multidisciplinary range of individuals, right from academics, clinicians, surgeons, anesthetists, nurse, and allied healthcare professionals, along with politicians, policymakers, and epidemiologists and economists. Because let's face the fact, it's policymakers that make this policy that influences the changes in the hospital. Yet it's not until 30 years after Dr. Halden made, more than 30 years actually, after he made that, that's when the Lancet Commission on Global Surgery was launched. It was launched in January 2014. So what is the Lancet Commission on Global Surgery? It's a research and advisory working group. It consisted of 25 commissioners, and they contributed with working groups and consultants from 110 nations. Excuse me, host, is it possible to mute everyone? Thank you very much. So as I was saying, the Lancet Commission was launched in 2014, and it brought out the landmark report. And this marked a turning point in the field of global surgery. The report identified 5 key messages, 6 indicators and recommendations to improve access to safe surgical care around the world. And as well, it provided a template of national surgical plan that was going to be implemented in countries around the world. So what are these 5 key messages? I'll go through them in summary. The first one says that 5 billion people still lack access to safe, timely, affordable surgical anesthesia care when needed. There's an additional 143 million surgical procedures that are needed each year in low middle income countries to prevent death and disability caused by lack of care. 33 million individuals face catastrophic health expenditures due to payment of surgery and anesthesia care each year. Investing in surgical anesthesia services in LMICs is affordable, it saves lives, and it promotes economic growth. And the last key message was that surgery is an indivisible, indispensable part of healthcare. Now we can see these 5 key messages summarize the need and the importance of global surgery. Now, these are the 6 indicators, and these are the 6 indicators that identify the strength of a surgical system. The first one is access, 24-hour access to timely essential care. But what does that actually mean? It means that a large proportion of the population can access within 2 hours a facility that can provide laparotomy, treatment of open fracture, and cesarean delivery. And these procedures are termed the bellwether procedures. You may come across this in literature, bellwether procedures. So usually they are referring to cesarean delivery, laparotomy, and treatment of open fracture. So the first indicator states that a large proportion of the population will be able to access these facilities within 2 hours. The target by 2030 is to make sure that a minimum of 80% of services per country have this access. The next is the surgical workforce density, that's SAO. Now, the number of specialists per 100,000 population who are working, that's surgeons, anesthetists, obstetricians. The target is that the procedures done in the 100%, like 100% of the countries should have at least 20 of this personnel per 100,000 population. So it means that in all countries, per 100,000 population, there should be at least 20 surgeons, anesthetists, and obstetricians. Next is the surgical volume. Surgical volume is the procedures that are done in the operating room per 100,000 people. And the target is set for 2030 to achieve a minimum of 5,000 procedures per 100,000 population. The next target is POMR, also known as perioperative mortality. And perioperative mortality is the all-cause death rate before discharge of patients who have undergone a procedure in an operating theater. Please, if you don't mind, will you mute your microphones? I'm getting some feedback. Right, moving on. The target for thanks a lot. The target for perioperative mortality rate is to reduce this rate in 80% of the countries. Next is the impoverishing expenditures. So impoverishing expenditures are expenditures which individuals have to spend money when they are looking to access surgical care. A target is protection from these expenditures in the household from direct out-of-pocket payments for surgical treatment. The next is catastrophic expenditures, and a target is also set at 100% protection from out-of-pocket catastrophic expenditures. These are the 6 surgical indicators that provide the strength of a surgical system, and they measure how equipped a country is in giving access to safe, timely, and accessible surgical care to its population. Now, advocacy is very, very important. Ultimately, it's advocacy that leads to policy implementation. Here on the slide, you can see in the lower right corner, I'm sure you can recognize the current Director General, Dr. Tedros, and by his side is Dr. Emmanuel Makasa, who at the time was serving in the Ministry of Health of Zambia. Now, this advocacy ended up with the implementation of a national surgical obstetric and anesthesia strategic plan in Zambia, which is in effect. It all means that advocacy is very key. Advocacy is what made the WHO Resolution 68.15 to be passed, that recognized essential and emergency surgical care as part of universal health coverage. Advocacy is something that we all engage in. On Global Surgery Day, we advocate, we are raising awareness. We want people to understand the impact lack of access to surgical care has. Take, for example, there's a woman that is living in rural Zambia or in rural South Africa. She's working in a construction site and she falls down. Now she falls down, people around her know that she needs immediate surgical care. but there are barriers that are preventing that from happening. Can you think of any barriers that this will happen? Just, you can type in the chat. So a woman in a rural part of the country, she falls from a height of 6 or 7 feet. The people around her are illiterate. The nearest hospital is about 260 miles. So what barriers do you think there are for her to access surgical care? Yes, financial barriers, that's right. Lack of ambulance services, that's transportation. That's also correct. Accessible road barriers, yes. Are there any more pointers? So yeah, we see transport, finances, skilled personnel, workforce, exactly, that's very true. So lack of awareness is very key. Traditional reasons, transportation barriers, yes. So all these forms, these are all the barriers that prevent people from accessing quality care. So in order to tackle them, we have to act with all stakeholders to attract these barriers. So implementation of a national surgical obstetric plan is not mainly only to deal with people in the hospital, but it also has to do with the workforce. It also has to do with service delivery. It also has to do with infrastructure. All these are put into consideration. So we must be real advocates if we really want to ensure that a change occurs. Policy ensures the safeguarding of rights to access. It also secures government investment in the healthcare system and healthcare-related infrastructure. As we've mentioned here, infrastructure is one of the barriers. Transportation, good roads, communication, awareness, ambulance. In an ideal setting, it would just be a call, an emergency call to the ambulance. Within 5 minutes, someone will come and pick her up. She'll be given emergency first aid. She'll be taken to the hospital. Emergency surgical care will take place. But in the reality, with the things on ground, this will not happen due to the barriers that we have mentioned. Now, a national surgical obstetric and anesthesia plan is a plan that is developed together with the national ministries of health in various countries, because ultimately surgery is not included in these national health plans. So this plan ensures it's working together with the Ministry of Health, and in so doing, the Ministry of Health takes ownership, and by that it's implemented towards achieving universal health coverage. It ensures that people around the world, people around that country, down to the rural areas, they have access to this plan. They have access to the services. But what are the steps to take in doing this? Why is it that since 2015, after the Lancet Commission on Global Surgery report was released till today, there are still a lot of countries that are yet to have this national surgical obstetric and anesthesia plan? It's all about how important does the country value surgical care? How aware are they? Global surgery is a new field, quite all right, but millions of people are dying every day from minor surgical cases because they have no access. I talked earlier on about cesarean section. A lot of mothers are dying because they don't have access to just that cesarean section. We have to be proactive. We have to advocate in our universities. We have to advocate to our local ministers. We need to come together to galvanize action. Only that's the only way we'll be able to make change. Because yes, I can sit down and just say, I'm tweeting. I'm just going to make a tweet and then that's all. We have to bring it from global, we have to make it local. You have to take local action within your vicinity. Try to make the change you can on a personal, on a community level. And that way, it will transform into a national action. So on the topic of advocacy, my slide is not moving. Okay, yeah. One of the organizations that's heavily involved with advocating for global surgery is Incision. That's the International Student Surgical Network. It's a non-profit organization, and it represents 5,000 plus members in over 80 countries, 40 national working groups. I'm sure a lot of national working group members or chairs are present in this call. Well, what's the aim? Why do we form this movement? Is it just for the sake of having an organization? No, the ultimate goal is to make impact and have that create change. Global Surgery Day. Host, do you mind muting people again? Please, can you mute your microphone if you're not speaking? Thank you very much. So Global Surgery Day. So Global Surgery Day is marked on May 25th every year. So this was actually brought up by Incision in 2015, and that was following the passage of the adoption of the World Health Assembly Resolution 6815, which was strengthening emergency and essential surgical care as a component of universal health coverage. So over the years since that time, we have continued in efforts of advocating for better health outcomes, health equity, through timely access to affordable, safe surgical anesthesia and obstetric care around the world. We work on several platforms. We aim to raise awareness, improve capabilities, and policies. Policies are what create the change. We do the groundwork. You work at the community level, you raise awareness, you generate momentum, you do research, you get data, you're able to present your case, and that will be able to influence policies. When these policies make the change, it will reach right down to the local hospital. Just the adoption of essential emergency surgical care as part of universal health coverage in 2015, it created a lot of change in the global health surgery field. We all know that we should all realize the power we have as individuals to make this change. The theme of this year's Global Surgery Day was surgery and SDGs. It's quite an important theme, considering the fact that the Sustainable Developmental Goals is meant to be achieved in 2030, and the Lancet Commission on Global Surgery, the key indicators are also meant to be achieved in 2030. There is an intersection, particularly because Goal 3, which is good health and well-being, has a target of universal health coverage. And because emergency and essential surgical care is now recognized as a component of universal health coverage, it gives us the momentum, it gives us the zeal and the ammunition to be able to advocate in all spheres for surgical care. At the current the ongoing World Health Assembly, of course, surgery, as out yesterday, surgery was yet to be mentioned, which is quite disheartening. And that is why a lot of advocacy is being done. Chairs of national working groups are recording videos and sending messages to member states at the World Health Assembly. On the agenda is trauma care. And it is hoped that access to safe and surgical care will also be included. But now, what can we do as students? What can we do as young trainees? We are not at the World Health Assembly. We are not in the positions of the Ministry of Health. But what can we do? One, get involved in research. You can get involved in different global surgery organizations to hone your advocacy skills. Get involved in global surgery projects. The key thing is to take action. Don't be all about talk. It's good to talk, but most importantly, it's good to do. You have to do something. Yes, we can talk. We can keep talking, because if I want to talk about the Lancet Commission on Global Surgery, it's going to take hours and hours and hours. Well, you can keep talking and talking and talking, but you have to do something. Make it a goal. You can start by saying, okay, in the field of research, how many global surgery papers have I read? What's the level of my knowledge in global surgery? Go to any of these global surgery organizations. They have a list of recommended resources, recommended papers that you should read. And one paper I will recommend for everyone, no matter your level or the level of your knowledge in global surgery, is the Lancet Commission report. It's a landmark paper, and it's something that is going to give you a background, a basis in the field of global surgery. So you can start from there. And there are more publications. You look at the authors, you find their emails, you send them emails, you want to engage with them. Twitter is a very good platform. There are a lot of journal clubs that take place. The G4 Alliance hosts a lot of webinars weekly. It's free. You just go to their website, get the link, go to these webinars, interact with faculty. Because yes, we are students, but you need the knowledge, you need mentorship, you need training. And that's how you can gain access to these people. They are willing to help, but you have to be able to reach out to them. One of the conferences organized in global surgery is the Incision Global Surgery Symposium. It's organized annually and it's virtual. So take advantage of this, because this is also another platform where you get to meet faculty in global surgery from around the world. You can easily communicate and have a chat with them. At the last Incision Global Surgery Symposium last year, there were about 120 faculty that presented and participated in the conference. Submit your research. The abstract deadline is just a week from now. And if there are any questions, you can feel free to ask, or you can contact us at the social media and website pages. Thank you very much.
Okay, thank you very much, Dr. Mashkoor. If anybody has a question, Jawahir, please go ahead.
Hi everyone. And I'm Jawahir Hassan Ibrahim. I'm some students or I study surgery. So I want to ask you, it's first time I joined the meeting today. So what I can do as member of global surgery? What is the it's first time today I joined this group, so you can tell me the main opinion of this group, or what we can do as junior doctors for global surgery?
Yes, thank you. Thank you very much for your question. So ultimately, if you're new to this field, the most important thing, first and foremost, is to gain knowledge, education, because it would not be wise for you to approach a faculty in global surgery when you know nothing about global surgery. So look for resources, look for articles, look for papers. I just mentioned the Lancet Commission on Global Surgery, the report. I'll look for the link and I'll paste it in the chat in a few minutes. Go through that, study it extensively, then join these organizations. There's Incision, there's GIGS, there's One.Surgery, there's GASOC. There are a lot of global surgery organizations that you can join. Through that, you'll be able to build your capacity, because for you to be able to take action, you need to have that capacity. Another way is to attend global surgery conferences or global surgery webinars or events. Most of the events due to COVID this year are online, and most of them are free, especially for people in low middle income countries. There's one coming up at the end of this month, if I'm not mistaken, is the Bethune Roundtable in Canada. It's virtual and it's free for everyone from low middle income countries. At these conferences, you get to meet faculty in global surgery. You get to meet colleagues, because you don't only learn from faculty, you also learn from students and trainees like you who have had this exposure, who have this knowledge, and will be able to guide you on which way to go. I hope that answers your question.
Thank you. أحسنت أستاذنا دكتور علي.
Okay, thank you. Thank you very much. We're going to take a last question. Dr. Ifin, let's go ahead.
Okay. Thank you, Dr. Mashako Isha. This presentation is very inspiring. My question is 2030 is 9 years from now.
Mhm.
And if it took 30 years for Lancet to get implementation, like what is like the core plans to make this safe surgery in like middle and low income country? Because what I'm saying this is like, how do you meet up like a place like Nigeria? Like how can you be able to like impart such knowledge and so that it could get implemented by 2030? Thank you.
Thank you very much for your question. It was actually not 30 years. It took much more than 30 years, because Dr. Halden, he made that statement in 1980, and the Lancet Commission on Global Surgery was just established in 2014. But yeah, that's like a very important fact. Just as the way SDG's target is 2030, and there's still a lot to be done. It's a goal that was set. It might not be achieved, but the indicators to achieve that will be by making sure that this National Surgical Obstetric Anesthesia Plan are implemented. In Nigeria, I know a plan was done a few years ago that included nursing, but what stage has it reached now? It's one thing for the government to develop the plan and says we're implementing it, but it's also upon the citizens in the country to demand that the government takes action. If there's a bill that was passed in the Senate, for example, and it's not been enacted, the citizens of that country have every right to demand from the politicians to make sure that it goes into play. Moreover, advocacy at the grassroots level is very powerful. We have all seen in the case of climate action what Greta Thunberg was able to achieve by the Fridays for Future strike.
Okay.
Grassroots level. Sorry? Grassroots level activism, grassroots level advocacy is important, but another thing is research, because we need that data. No matter what you're doing, if you want to influence policy, you need to have a backing. You need to have data. You need to have that research to say that, yes, if you don't do this, this is going to happen. If you do this, there's going to be economic return. There's going to be decrease in the amount of people that are dying, things like that. So it's always good to have this balance. Advocacy, education, research, these three go hand in hand. You cannot do one without the other. All have to come into play. 2030 is quite close. it might not be possible for us, for all the 6 key indicators to be achieved by then, but how far are we able to go by at that time? What progress are we going to be able to make? That's the most important thing. Hope that answers the question.
Okay, thank you. Thank you, Dr. Mashkour. We're just going to continue with our panel. Your host is going to be Abdullah Sati from Jess. He's our treasurer.
Thank you, Dr. Mashkour, for this amazing presentation. And you actually burned out all the panel discussion we are going to talk. I can feel the eager and the want to change in you. And I hope your speech flames the spark inside of every and each one of us to drive the change in the future, inshallah. So welcome again, everyone. We hope that you're learning and enjoying the forum so far, as we had many in-depth insights from Dr. Mashkour. And so thank you again for joining us. Now we will move to the next section, which is the panel discussion, in which we are going to focus on global surgery in Africa. The panel discussion is titled Global Surgery in Africa, Current Status and Future, in which we are going to touch and highlight different areas of global surgery through of amazing African health leaders and athletes joining us.
Abdullah, could you please unmute your phone, your microphone? Abdullah, your microphone is muted. Could you please unmute your microphone?
Yes. Is it me that you are talking to me?
No, I'm talking to Abdullah Sati, our treasurer. Could you please unmute your microphone? We didn't hear you. Okay,
oh, you didn't hear all that. I'm sorry. Okay. Okay, I will start by introducing myself. My name is Abdullah Sati, and I'm a third-year medical student from the University of Jazeera Faculty of Medicine. I'm currently serving as Jazeera Student Surgical Society Treasurer for the term 2020-2021, and I'm very delighted and privileged by being the moderator for this panel discussion. Now, let me introduce our amazing panelists. Joining us first from Somalia is Dr. Awale M. Abdullahi. Dr. Abdullah is a consultant surgeon at the International Hospital in Somalia. He is also a senior lecturer at Somalia National University and Samid University. Please, Dr. Abdullah, confirm that you're here by unmuting and saying that I'm here. So please be welcomed.
Thank you for welcoming me. And I don't know how you can hear me. I'm very happy to. Yes, I'm very happy to participate. I don't know, my camera is not functioning.
No, it's okay.
I think if you can allow me, I can open it, my camera, no problem.
Yeah, okay.
Just I wanted to discuss about the the capacity of health infrastructure in Somalia.
But beg your pardon, but before you start, can I introduce the rest of the panelists and I can come back to you?
Yes, thank you. My name is Dr. Awale Abdullahi. I would like to correct you. I'm currently now working at Dr. Sumayit Hospital, which is affiliated CIMAD University. I'm a consultant of general surgery, a surgeon, and also I'm a senior lecturer at Somali National University and CIMAD University. I've been working in Somalia for the last 14 years. I've been trained in Uganda and South Africa in surgery, and I did it on those two big universities. One is at Makerere University, and I also went for training, a short training at University of Cape Town. I have usually what we do in Somalia is, as you can understand it, before I can say it, four years ago, It was one of the common surgical conditions that we were working was the trauma cases. But nowadays, we usually do for those elective cases, as you know it, and Dr. Mashkur talked about it, how the global surgery, affects in our country. In generally, all over Africa and generally in our world. Yes.
Okay, thank you so much, Dr. Abdullah, for this insight. Now moving to the second panelist, joining us from Sudan, Mr. Jamal Mustafa. Mr. Jamal is an MBBS degree holder in the year of 2000 from the University of Jazeera Faculty of Medicine. He is also an MD degree holder at General Surgery from the Sudanese Medical Specialization Board in 2008. He attained his fellowship in plastic surgery in 2014, and he is attained a Master of Science of Health Professions Education. He is currently the Director of Educational Development Center at the University of Jazeera Faculty of Medicine. Please be welcome, Dr. Jamal Mustafa, and confirm that you're here with us.
Hello, Assalamu alaikum. I'm Dr. Jamal Mustafa. I'm a plastic and reconstructive surgeon. I have been working in Sudan for the last 20 years. I have trained in Sudan, in Egypt, and part of my training in the United Kingdom. I'm also a director of the Educational Development and Research Center in University of Jazeera Faculty of Medicine in Sudan. Now I'm welcoming everyone here in this forum in global surgery.
Thank you so much, Mr. Jamal Mustafa. And our third panelist is Dr. Ifeyinwa Orakwite. Ifeyinwa is a medical graduate of Bogomole National Medical University in Ukraine. She is also the former Vice President External at Incident Nigeria. Ifeyinwa also has participated in the International Students Medical Research Group in Kiev, Ukraine in 2016. In 2018, she participated in the International Students Conference in Latvia, Riga. She also participated in Incident Global Surgery Symposium in Belgium. She also was part of the Royal Association of Medicine in London, United Kingdom. In 2019, she participated in the 11th International Symposium on Targeted Alpha Therapy in Ottawa, Canada. She also participated in the Infectious Disease Conference, Advancing Science and Improving Care in Washington, D.C., United States of America. Please confirm that you're here with us and open the mic. And yeah.
Thank you so much.
Thank you very much, Dr. Ifi. We're glad to have you here today with us.
Thank you.
Our fourth panelist is Mr. Abdul Hakam Abul Bashir. Mr. Abul Bashir is a medical doctor in pediatric surgery from the Sudanese Medical Specialization Board. He also works at Khartoum Teaching Hospital, and he is a lecturer at Nabta College of Medicine. He has a Master of Medical Education, and he is an expert of evidence-based medicine. He is also part of Al-Tababa Evidence-Based Institute. Please confirm that you're here with us, Mr. Abdul Hakam. Can you unmute? I can see him on the panel, so let's proceed to our fifth speaker. Joining us from Libya is Ms. Sirine bin Salim. She is a fourth-year medical student at the University of Tripoli in Libya. She is part of Incision Libya, and she is the regional representative.
Hello, Assalamu alaikum.
Okay, wa alaikum assalam. We can hear you well.
Hello, Assalamu alaikum.
Yeah, wa alaikum assalam. We can hear you well. Thank you so much.
Welcome all.
Welcome.
Welcome you all. Yes, I am Mr. Abdul Hakam Abul Bashir Yusuf. I'm pediatric surgeon at Khartoum Teaching Hospitals. My MD was from the Sudan Medical Specialization Board. I'm a teacher at a lot of universities, mainly at the Nabta College. Now recently I'm a medical director of an academic director of Al-Tababa Evidence-Based Medicine Institute. Welcome everyone here. Welcome all of you, yes, and all bodies which are participating in this forum. And I hopefully to go towards global surgery. If you are allowed for me I'm asking you, can I close my video, because I think that
Yes,
video
feel free.
lets the
Feel
the
free to
network
close
to
the
be
video.
a little bit heavy. Yeah.
Okay.
Okay. Thank you very much.
Okay, proceeding the introduction session, joined from Libya is Ms. Sirin Ben Salim. She is a fourth-year medical student at the University of Tripoli in Libya. She is also part of ISAGE Libya, and she is the regional representative. She is the regional representative of Africa at the Women Surgeons Organization. She is also part of the April Health Awareness Foundation. Please confirm that you're here with us, Ms. Ben Salim. So
Hi,
proceed.
everyone.
Thank you so much. Hi, how are you doing?
Bye.
Okay. Last but not the least is joining from Egypt. She is Dr. Nermin Badawi. Nermin is a fifth-year medical student at Zagazig University in Egypt. She is the chair and the founder of Insurgent Egypt, and she is Egypt's coordinator for the Isomer study and an IFMSA certified medical education trainer. Please, Ms. Badawi, unmute and confirm that you're here.
Hi, everyone. Glad to be
Hi.
here.
Thank you so much. Thank you for every one of the panelists, and thank you for accepting our invitation to and being here with us here today. So before we start the panel discussion, I want to clarify that we have 10 questions. Each question is consisting of 2 to 3 questions. Each question is going to be directed towards one speaker who has maximum 5 minutes to answer it. And if we still have time, we would be pleased if other panelists want to share their insights. And if participants have any questions, just type it on the chat here in Zoom or in Facebook Live. And at the very end, we will try to cover as many questions as possible. Now, let's move to the question, starting with Dr. Abdel Hakam. Starting very basic, Dr. Hakam, can you hear me?
Yes, I'm hearing you.
Okay, so can you describe the global burden of disease amenable to surgical care and what the sustainable developmental goals affected by global surgery?
Okay, thank you very much and welcome all panelists. I'm so happy to participate today. Firstly, let us to say that when we are talking about the global burden, we have to look for the healthcare system as a whole. About 20 years back, global health was looking for the at individual levels, which is that led to mask a lot of issues related to the system. Concerning surgical care in low and middle income countries have been neglected for years by all of us, mainly by our politicians, and it represents approximately about 30% of the global burden of the disease, surgery by itself. So it is a huge number, so that many people they are unable to, and many people with surgical conditions they are unable to reach their essential surgical service. That which mainly will lead to loss of life and reduce of their welfare for millions of people. Also, if we are, let us to remind ourselves by the 3 dimensions of access for surgery as timelines, which is so important because every patient have to, on every patient with surgical conditions have to reach the surface within limited time. And the other dimension is that the surgical capacity by itself, there should be a good surgical capacity when we are providing surgical service, and the safety by itself, and the service which have been provided should be affordable. So according to WHO records that about 5 billion of people are unable to reach the surgical service, which is amazing for us. And they found that about those 5 billions are about 28 to 32% of global burden of disease can be attributed to the surgical treatable conditions. That is unbelievable. About 28 to 32% are treatable conditions. So we need great efforts in order to change this burden of global burden of surgery related to the surgery. I think that we have to have to address our movement toward to direct to create a world in which all people must have an access to emergency and essential surgery. If you have been succeeding for that, or if you are putting that goals in front of us, I think that we will be able, inshallah, to reach it, because surgery is indivisible and indispensable part of healthcare. Nowadays, surgical service is part of healthcare, and no matter to escape from that service, and that service is needed through all people, and a lot of people are facing or lagging the surgical service, mainly in our countries in Africa. So that hopefully, after this forum, we will end it with some sort of discussion from all panelists to solve that burden of surgical care related to the global burden of health.
So the second part of the question says that what are the sustainable developmental goals that are affected by global surgery? Mr. Abdul Hakim.
Oh, okay, that is so interesting questions. The sustainable developmental goals. Firstly, let us to say that when we are aiming to achieve or to achieve the sustainable developmental goals, we need from all of us to agree on one goals, in one global goals, and we have to be committed for it through one visions and through same missions for us, all of us, and we have to be able to develop develop a strategy to achieve that goals, so that I think that it will solve a lot of problems. And from that one goal, which will be an international goals, we have every country then can tailor that goal according to their facilities or according to their local context. This is the first one. Secondly, nowadays, we know that a lot of people are talking, but they didn't know how to. They don't know the way that to achieve their talk or to put their talk in place. So we need specific tools to implement our goals on the ground. And there is a lot of tools. First of that tools, I think that everyone must be the tool, and he must start to change from his place. Everyone has been his place. He have to start to change from it, and in order to transform every health system in your local context, and there will be national and be global. Second thing, I think that we have to work in multidisciplinary MTT. All service will be provided in multidisciplinary team according to your local available other department, and we have to work and we have to do some sort of national collaborations for all surgical institute or surgical societies in our national, and then to move that collaborations to the regional area, and then to be for global partnerships in order to achieve that one goal. Also, we need to know our current situations, our current surgical situations. Firstly, before to start, we need to know our current surgical situations, where we are. By auditing our all aspect of our surgical to put in ground that way we are from the standard. The second thing that is important, we need to conduct a lot of research, especially research that is related to implementation of surgery, because nowadays we will not be able to talk without data. And in Africa, that what we're suffering is that we don't have basic data for every surgical conditions, which are so sad how we can implement something and we don't know even what is the epidemiology of certain disease which is related to every country and every situations in countries. Also, we need to let our practice to be an evidence-based. Surgical practice should be an evidence-based, and we have to be adherent to the quality, because evidence-based practice will reduce the expenditures and let us to fill the gap between the huge knowledge which is have been created and the part of of implementations to our practice, because there is some gap here, and this gap will be filled by evidence-based medicine. Also, we need to monitor our implementations. After we are implementing some things, we need to monitor it in order to achieve the sustainability. Without monitoring, we cannot maintain our sustainability, because sustainability needs continuous monitoring in order to know that your implementation is going well and you are not out of the scopes. Also, we need some sort of non-governmental participations. We have not always to rely on the government. We need and social movements and contributions from the community participations for the our service, for the providing of surgical service. And one of the very good things that like this forum will be contributed a lot and will share a lot toward to achieve our global sustainability, for that huge steps which have been recorded for the global health.
Thank you so much for your insights, and that is amazing to hear from you this in-depth insights. Now we will move to the second question that is directed towards Dr. Ife from Nigeria. So why do you think global surgery is a pressing matter in Africa? The mic is yours, Dr. Ife.
Thank you, everyone, and thank you for Dr. Mashaku and Dr. Abdullaham for that insight. And why global surgery is a pressing matter in Africa. I think, like, as Dr. Mashaku, I'm gonna be like trying to refer to people that have already spoken, because mine is going to be a little bit of repetition of what they have said. Like, the value that is being placed on health, like it was for a very long time, Africa believed that, like, if you can be able to acquire your personal wealth, you could meet any world class health treatment. But the answer is no, because according to Abraham Maslow's hierarchy of need, 1943, he says, like, health is the second basic need of man. And if, like, there is no much attention that is being placed on health, like, I don't think there's a way we could move forward, because, like, every person needs to understand, like, this is important, the way, like, the shelter is important. And the only way we could achieve this is, like, continuous awareness. And for me, like, hearing of global surgery for the first time was through Facebook. That was like 2018. Dr. Mashaku posted on Facebook, and I read about the incision. I took my time to, like, make a little research about the conference, and it was very interesting about global surgery and the impact. I was like, okay, cool. I want to go to the conference and be able to, like, understand what is required, and to be able to move forward from global surgery and its awareness. And one of the things that, like, that triggered my quest for deep knowledge, I remember, like, for every session, I want to have, like, a conversation with the speaker. And most of the speakers are from a very rich Western country. They would leave whatever thing they are doing here, and they will go down to middle and low income countries, and they will devote their time and spend like a year or two there, trying to help people, trying to help the government, trying to help the health worker there, to be able to understand that, like, global surgery is a very important need of man. And what they do is that they go down, they try to tell them that, oh, surgery is not expensive, you could alternate another means of providing care to the people. And the most striking thing that stood stand for me is that all of them, different country they went to, is the same thing: alternative medicine. And if we from the low income and middle class country could be able to like pay more attention to that and see the need of like alternating for surgery, you don't have to wait to be able to provide a world class surgery, but the most important thing is to save a life. And if you could like pay more attention to that, that means that there will be an improvement. It's just a step by step thing. But that was why I asked Dr. Mashaki in one of my question session. I asked him, what is the plan in 2013? If 2013 is 9 years away from now, and the only way like I feel that like is the way to move forward is this: is like the grassroots, being able to like tell keep awareness. Because I sometimes I try to like go to Lansa to look to read the information. Most of those people that put up those articles, they are from the Western world. Whatever thing they put there, they put it most especially in terms of what they see in the developed country they are into. They really don't really pay so much attention. But you being from a country, you understand how your country works, you can be able to like narrow down what is important for us. And the most important is for us right now to be able to like create more awareness is on like is alternative means of surgery. And if we can be able to use every platform like every social media to be able to like keep awareness about like importance of alternative surgery, I think like it's going to help Africa as a whole. For now, like from there we could take a step upwards. And another thing is hygiene is very very important, because if you can't talk about like a safe surgery without a successful surgery. And if the priority of hygiene should be paramount for every country in like where we are from, we should pay very more attention to hygiene. You don't have to like have the highest standard, as I said again, the most highly expensive equipment of sterilization. Being able to like I schooled in Ukraine. Ukraine is not like a very high it's a wealthy country, but that was something that took stand for me whenever throughout the time I go for clinicals. Like the material they use is not, you could see that like they have used this material for like so many years. Is warm out in your mind, you'll be looking at it, is this thing sterilized? But if you go to the autoclave they use for the sterilization, you'll see like how they are able to recycle. And if and personally I try to make a research, like I'm from Nigeria, and how is the wealth of Nigeria comparison to Ukraine. I found out like the Nigeria, like my country, has more economic uh resources than this country, and yet they have the basic need of a man. I never experienced of seeing somebody being died of surgery. How many months I stayed in the hospital, all my cycle I keep going doing around the whole different departments. I think like if we could like focus on this restructuring. Africa has the resources to be able to do this restructuring. We should not pay so much attention to very expensive things. If you could look down and start from the scratch and work with what we have, I think like we could like get even the 2013, we could like say, okay, this is the growth we have from so time to so time. Thank you for your time.
Thank you
I
so
have
much
a
for your
question.
answers, and you touched many areas that is interesting in global surgery, especially in Africa. And I hope all of the thoughts you said and mentioned to be applied as soon as possible in Africa, so that all countries will rise and global surgery would not be that significant matter as it is now. So, moving to the next question, it is directed to Mr. Jamal Mustafa. So, Mr. Jamal, based on the fact that there are 6 criteria of surgery, one of which is timely access within 2 hours, can you elaborate more on this point, on how is it related, i.e. how is timely access within 2 hours is related to safe surgery? How can that save life? So this is the first question.
Well, before starting to talk about timely access to surgery, I have to talk about my country, Sudan. That I have to emphasize that there is no available data related to the number of surgical procedures per the 100,000 population or the rate of perioperative death. We don't have enough data. Here, I have to say that we have to establish our own data by research first, and then the statistics from Sudan, according to the WHO, is the risk of catastrophic expenditure. Dr. Bashkur has talked about it, but here in Sudan is very high because it's approximating 70%, and the risk of impoverishing expenditure for surgical care is almost 48%. These are percentage and numbers are unbelievable because Sudan was under sanction for almost 30 years. You can see that in Sudan, the mortality rate or the maternal mortality rate in Sudan in 2017 reached to 295. It's approximately 300 per 1,000 for 100,000 live births, and you can compare it with a country like Italy. It's two ladies died, or maternal mortality rate is 2 per 100,000. You can imagine the difference between these two countries, one in a low resource area and the other one in a rich country. You can see the difference. Concerning timely access to surgical care, it should be 2 hours vehicle distance in low and medium countries. That the access does not depend only on the time line or the time frame. It has another factors like surgical availability, like the availability and the affordability of the surgical care, because we have to say that the time access to surgery related to the availability of the surgical care and the affordability of the surgical care. We have 8 resources in some study done internationally in low resource countries, in 8 resources considered as essential for safe basic surgical at hospital. The equipments and supplies like consistent oxygen supply, the essential medications like antibiotics, analgesic, anesthetic drugs, and functional pulse oximetry and functional sterilization, and the infrastructure like a consistent electricity supply and a consistent supply of clean water, and the personnel or the workforce. And the workforce here in the form of accredited anesthetic provider and accredited surgical provider. These are the resources needed for the availability of the service. So I will tell you example that if I have a surgical care hospital and the individual needs a service and the distance is 8 hours vehicle distance, so will not be accessible, and the time access should be within 2 hours vehicle distance. So it's related to the availability of the health care and the affordability. The second thing, sometimes the healthcare or the surgical care may be available, but it's not affordable. This is another boundary in healthcare. I think we need to have situation and analysis in Africa, in sub-Sahara countries, and in sub-Sahara African medical schools. We have to have situational analysis and need assessment and more research to improve the sustainable developmental goals. I hope that I am able to answer the question.
Thank you so much, Mr. Jamal Mustafa. Now we will move to Dr. Abdullahi from Somalia to talk to us about the infrastructure. What is the infrastructure in surgery, and what are the human resources needed to perform surgery? Mr. Abdullahi.
Thank you. I would like to greet my other colleagues who are in here. If I talk, I don't know, can you hear me?
Yes, we can hear you well. Proceed.
So if I talk to the infrastructures that is needed in our health system, especially in surgical setups, there are so many needed in this setup. For example, what we need is the road has to be completed. The patient is reaching to the hospital. Also the building of the hospital, or the surgical instruments. And you know, nowadays our world is getting developed. People are using endoscopic surgeries, and that's also another issue is that we have currently in African setups. The other thing is, you know, our Millennium Development Goal. All of us know is that everyone has, everyone has a right to get a surgical, surgery treatment, and that Millennium Development Goal, I think that was number 4 or number 5. Everyone has to get, and it will be the right of that. The other infrastructures, the other challenges that we have in our infrastructures are the sterilization of the instruments, the OT, the ambulances. So those are the challenges that we usually meet when we are not in the cities, for example, the capital, or sometimes the big cities, but in the rural areas. As if I talk like in my country, usually we have every month or 2 months, we usually do some kind of surgical camis, free surgery, to the people who are unable to come or to reach to the tertiary, or maybe sometimes to the district or general hospitals. So because of we already talked about the accesses, the fee of the surgeries, and so many other issues. If I also talk about the human resources, the human resources is also one of the main challenges. If you compare to the developed countries like our brothers in Qatar, the country Qatar, you can see them 70 per 10,000 patients, 10,000 population, they have almost 70 doctors. Comparing to, for example, in one of our African countries like Somalia, or maybe like other countries, maybe 10,000, we may have 1 doctor. So the ratio will be very, it will be very difficult to compare those countries. Or maybe Cuba have also more than 60 per 10,000, 60 doctors per 10,000 population. So we have less human resources, the less skills, and that also usually make to some of the African countries, especially in our country, people who are not certified, who have they have the skills but not certified, came to the field, especially the surgery, the anesthesia, and also the obstetric gynecologist, and treating patients. And you can see the malpractices that our patients can happen. For example, if I share one of the challenges that we met, sometimes you may see, in order, some people may seek to have more money or to treat a patient while they don't have the certificates. Sometimes someone who has no background in, for example, in medicine, maybe he just only finished the secondary school, but got some training from the hospitals, went to the district or maybe to the rural areas into health system 4 or something like that, go there and do some surgery like laparotomy or cesarean section, and patients can get challenges. I remember, is it 2 years ago, one of the rural areas. I remember it. There were a patient referred from there. One of the, unskilled, staff went to do cesarean section, and the patient died on the table. And the people and the local authorities called us as a surgical society to discuss about how to solve that issues. So many issues which are usually coming to our setups, and we need to sort out all those issues to train our medical students, to prepare the future doctors, and to also think about it in a global 2030 to reduce all those, deficiencies or the problems that we are having. The other things that we usually have to think it, and the challenges we are having in our country, let me say 5 to 10 years ago, our government was weak. We're not controlling about the hospitals. All the hospitals, especially the public hospitals, were under the international NGOs like MSF, like ICRC, and sometimes are still there in our country. Those international NGOs are doing their best, but usually what we need is to have a strong government which thinks about reproducing health service, upgrading, and the Minister of Health is doing something. As you know, we need to have a functioning, Minister of Health to reduce that gap. Those are the issues, and I wanted to share with you in general.
Okay, thank you so much. Thank you so much, everyone. Thank you so much, Dr. Abdullahi. And I just want to remind you with the panelist rule. I just got notice from the host that we are running out of time. So again, everyone has only 5 minutes to answer his question. And if we proceed that 5 minutes, I will have to stop the speaker and move to the next question. So thank you so much for your for your in-depth insights and great presentation, Dr. Abdullahi. Moving to the next question. It is also to Dr. Ifi. This is speaking about safety. So what are the perioperative safety measures for surgeon and patients that is put into consideration when surgery is to be performed?
Thank you for the opportunity. I noticed that some people were saying they can't hear me in the comment section. I hope everyone can hear me.
Yes, I believe they hear you.
Okay. Okay, the safety for preoperative mortality rate and prevention. According to the Lancet Commission, preoperative mortality rate is as one of the 6 key indicators of the strength of the country's surgical system. Despite its wide use in like a high economic country, yet it's like a problem. And when research was done, according to Lancet, only a percentage of 46.2 that were able to have like a record in appendectomy, cholecystectomy, and cesarean section. Why no little or no data is being placed on intracranial hemorrhage and head injury? And I believe that like even a common man in Africa understand like even without the ambulance station, once there is I will use my country as example. One of the major cause of death in Nigeria is like road accident. Like in a situation where like that, like a layman passing by knows that like, oh, I have to help the people, we have to help this victim. And most of the things they do, they use their vehicle to convey those people to nearby hospital. And like I was asking, when I was looking at the panel, I remember like last week, somebody called me from Nigeria, and the person had an accident, was in a very fatal accident. There was life that was lost, and one got unconscious, which was unfortunately he got survived. And I took my time. I was asking the girl some like personal questions because I once had an accident. I wanted to have like I live in the United States right now. I wanted to see like where is the surgical care in Nigeria? What does it look like at the moment with all the whole awareness that is going on? And she told me like they had an accident by 3 p.m. in the afternoon. And a nearby Reverend Father from a Catholic church was able to convey the deceased patient and the unconscious person to the nearby hospital. While like them later, the road safety people came to took them to the same hospital. And in between the time they conveyed the critical patient and them to the hospital was like 10 minutes. And when they got to the hospital, nothing, the two people that is in a critical condition has not received any care yet. And she overheard the nurses saying like the health workers in that community, because she says like a rural hospital, so they have no equipment, there was a lot of flies, the whole place looked dirty. And they overheard them saying that, oh, they don't have like a generator because there was no electricity. They don't have, they have a generator actually, but they didn't have like a fuel to put in the generator. And she saw the neglect the whole health workers were giving to the girl. She just held the girl's hand and prayed for the girl because she didn't want to witness the girl die in her front, and left. And 30 minutes later, the girl died. And my question when she was telling me this, if like a layman understands the urgency of care, and she understand and prayed for somebody that she think that was not able to survive. 30 minutes time is a long time to save a life. And they put a draining tube in the girl to drain the blood because there was no oxygen, which is like the very primary thing that should be provided to care. And I now use my own scenario. I was involved in a car accident, and within 5 minutes of the accident, it was a very fatal accident. The police were there, the ambulance were there. The ambulance left when they noticed that I did not have any serious injury. And the police told me that I could walk by to the emergency care and just have a checkup. And they had a total checkup on me. I don't want to compare like a Western world to like a developing country. I'm not gonna do that. But like the question is that like, if even she that did not have any injury, they packed them to the hospital. I have to use the word packed. They packed them to the hospital. They left them there from 3 p.m. that they had an accident to the next day, which was 5 p.m. when they got a car that conveyed them to their city they were going to. And that was when the family took her to the hospital for proper assessment. What if somebody you are looking at that thinks that the person is not having like a serious injury, is having internal bleeding? That long time is able to kill the person. Like, it is very, very important. Like I keep saying it, like equipment to the bigger cities might have the opportunities, because if they were fortunate to have that accident in like a big city, they could like receive the proper care they could. But like I should like recommend that like even the smallest rural area should be provided with like the basic equipment, especially even if you have like a generator. Always make sure there's something they call primary. The generator should have a fuel, because I believe that the disease couldn't have died if they had an opportunity to put an oxygen mask on the girl. Like if the head injury is not being paid so much attention to, and the neglect of the people and the flies, because you not supposed to see that kind of sanitation in a hospital, no matter being a rural area or not. You have to have like a high standard of hygiene. If we can be able to like, I don't know how we can be able to, I keep saying it's only by awareness and keep informing people the importance of like health, importance of global surgery, because surgery is like the number one thing to me. I don't know the data that is being placed, but to me, I say that surgery is like the most important part of medicine. If you can be able to give that immediate care, because 1 minute, 2 minutes is very important to save a life. If you could like pay more attention to that, we could go further than that. And I have a quote: growth is everyday intention change, and it all starts from the mind. And I hope that one day we could get there. Thank you.
Thank you so much, Dr. Ife. This is really depressive, and unfortunately it is the reality here. But with advocacy, as Dr. Mashkoor said, and the collaborative work, inshallah, we're going to change this situation to a better one. And moving to the next question, it is to to Dr. Abdullahi again. It is about a devastating matter that spread all over the world. It's the COVID-19 pandemic, which has a devastating impact on health system worldwide. So may you give us some insights about the strategies made by your country, i.e. Somalia, to maintain the surgical systems during the pandemic, and how do you envision the system in the post-pandemic era? Please unmute, Dr. Abdullahi.
Thank you for the question. Really, COVID-19 affected all over the world. Can you hear me?
Yes, we can hear well.
Yes. So COVID-19 affected all over the world, and even not only by health system, but also affected financially, psychologically, all over the sectors. But if I talk to international and also in Somalia, what happened at the COVID-19 affected, especially in our surgical setup is, internationally, what happened, the surgeon is an old surgeon is got early retirement. The human resources like scrub nurses and others working in the OT, or maybe some of them went and the students went to work on the COVID centers. You can also see in surgery we need the instruments to buy from other centers. The people movement were restricted due to the COVID. Markets were not functioning, and you can understand it, the morbidity and the mortality of the surgical cases. The COVID were affecting the lungs and the respiratory system were really more complicated. And the other challenges that we are having in general, not only in Somalia, even the world, that the personal protective equipment were not available, all the health staffs. So those are the challenges. What happened in our country was, the private hospitals were closed, the public hospitals were really functioning, but they stopped it working on elective cases, especially our hospital, Dr. Sumait. What happened? It was shifted. The hospital was General Hospital and shifted to COVID-19 center treating patients. And the reason we are the only hospital, we are the second, not only the second after one of the tertiary hospital, we are the second hospital that has the oxygen machine who were managing those COVID-19. And all our hospital staff, including the senior doctors, the junior, the nurses, the midwifery, all they were helping the COVID-19 patient. And COVID-19 patients were not only complaining about the respiratory system, the symptoms, but also we're having other conditions. You can see patient who is COVID-19 positive and also having surgical manifestations. So we were managing all those. And also what happened in our country, we give the students of the universities were not in the hospital, so the training were not there. In order to keep the student to be safe. But later what happened, the private hospital is thinking that they got some chance in related to financial resources, then now they opened the hospital. The public hospitals were doing the protocol is general, like testing patients who are in need, especially both emergency and the elective cases, to do the COVID-19 test, especially that swab test or the antigen, which we got some challenges, and you can understand the challenges is sometimes you have to take care about those patients. In surgery, most probably it has complications, and patients when they have the coronavirus, they are also having more complication comparing to the normal population. So our guideline is especially in our hospitals and generally we stopped it functioning doing our surgery, but some other private hospitals where they got the chance to advantage those high number of those patients.
Okay, thank you so much, Dr. Abdullahi. That was great insights from you. We hope everything gets as it was before the pandemic and even better. So the pandemic just revealed that some problems that were there before the pandemic, but it just touched it and highlighted it and brought it to the surface. So moving to Dr. Sireen, so as a student and youth-led organizations, how can we contribute to global surgery, and what are the organizations that can help students to engage in global surgery?
Hello, everyone. It's nice to meet you all, speakers and attendees. You know, the student role in attending global surgery is with the global burden of surgical disease, medical student attendance and participation in global surgery plays a significant role in promoting global surgery healthcare. Through what? Through education, collaboration on research projects, communication between students and current global surgeons, international conference attendance. All of this will increase the students' awareness and sense of responsibility. Also, it has an important role in the development of the next generation and considered as an important factor influences med students' decision to pursue surgery. Thank you.
Thank you so much. I hope everyone learns from this, and every students here try to engage in the contribution and contribute to the development of global surgery in its own context and in the context of Africa. So moving to the next question, it is to Dr. Nermeen. So what is the importance of research and how research contribute to the enhancement of global surgery and surgical care?
Research is really important in global surgery, especially in lower and middle income countries, which are the majority of Africa. In Africa, we lack the data that are standard in high income countries. I believe that medical students have a large role to play. For example, there are a study in Sierra Leone. It was about their unmet needs, their surgical unmet needs, and it was performed by 4 teams of 12 medical students. This is an amazing study and an amazing example for them to estimate the burden of the whole country. Is such an achievement, and I think we should follow in their steps. We need to evaluate the problem in our countries to help create the solution. Also, international collaborative like Global Surge offer an opportunity to students from LMICs where research opportunities are scarce, and I think medical students should look for international collaborative and also for their NGO. For example, in Egypt, there is Incision Egypt, and Sudan, I think Sudan, Incision Sudan, and Jazeera, of course. So that's it for me.
Thank you so much, Dr. Nermeen. That was very insightful. So moving again to Mr. Jamal Mustafa, how can we include global surgery in the medical curriculum?
Well, in sub-Sahara Africa medical schools, I remember a study conducted in 2010 and published in 211 about medical schools and the impact of the medical schools in the community and the social accountability of the medical schools in sub-Sahara Africa. I think in schools adopting the innovative curriculum, it will be quite easy to include the global surgery in the curriculum because there will be a continuous development of the curriculum, a continuous review of the curriculum, and probably there might be a program evaluation to study the impact of the school in the community. I think that, for example, in Sudan, I'm talking about Jazeera Medical School, it's quite easy to include this global surgery in the next um, curriculum review. I'm here talking in a position of responsibility because I'm the director of the EDC in Jazeera. I think before including this global surgery in our curriculum, we have to raise the awareness about global surgery in our communities. We have to have more situation analysis, right, as I mentioned before, and the needs assessment, and to conduct more research about the surgical needs in our countries, and then we can achieve the goal of sustainable development, and by including this global surgery in our curricula and making partnership with the national health sectors, and we can move forward to move the standard of surgical care nationally. And I hope that probably other medical schools in Sub-Sahara should look for this to be included in the curricula of their medical schools.
Thank you so much, Mr. Jamal. Very promising future for Jazeera students at the University of Jazeera. And I hope this spreads to also to other medical universities around the world. So that sums our panel discussion for today. And thank you so much to all our panelists, and thank you for your time and effort. We know that every and each one of you has a busy schedule, sorry. And you made it here to the panel, and thank you so much again. Now, the next part of this forum will be networking and discussion, where the participants are going to divide it into different rooms. So where you can go and discuss and network with each other and highlight the global surgery issues in your country and from your opinion and your perspective. So Fadi, the mic is yours if you're here. Thank you so much, guys.
Our dear guests, I think we have 10 minutes for discussion, and networking. So we are divided in subgroups. Everyone should back to his group in the WhatsApp group, and there will be a Google Meet meeting. There will be a discussion and networking. We will have only 5 minutes, then we are going to back here to continue with the efforts of global surgery in Africa. Thank you. Just 5 minutes. Thank you, everybody. Again, we only have 5 minutes for networking and discussion. So go back to your WhatsApp group to find out the links. Thank you. Okay, everybody, have you can everybody, are you done with your with your discussion and networking? If you're done, please join us now. Okay, our group administrators, please. Our group administrators, please, everybody join us here so we can continue. We're so sorry for this late. Okay, everybody, we should proceed to continue the efforts of global surgery in Africa. Mr. Fadi, please continue. Please start. Thank you.
Hello, everyone. My name is Fadi Abdelaziz, final year's medical student, University of Jazeera, occupying the position of agent of global surgery and outreach on Jazeera Student Surgical Society. First of all, I am so glad to have you here with us sharing this wonderful meeting. I will be your moderator panel of efforts of global surgery in Africa. So please, and I will be joined by a medical student and doctor representing different organizations that involved in global surgery to discuss their work and their effort of global surgery in Africa and the work toward the student in global surgery. So please welcome me with Mrs. Jumana Azuz. Are you hearing me?
Yes. Hello, everyone.
Hello, Mrs. Jumana. Mrs. Jumana Azuz, member of Student Medical Association, member of BR team of Student Centers of University of Tripoli, Incision Libya social media team manager. Good evening, Ms. Jumana.
Okay, could I start?
Also, please welcome me with Mr. Abdullah Sayyid Hashi, BDY, Syria Anesthesiology and Reanimation in Mogadishu, Somalia.
Hi, everyone, and thank you for having me. Thank you for organizers Jazeera Student Surgical Society. Thank you, all of you.
Thank you, Mr. Also welcome me with Mr. Otobo Daniel David, final year medical student, Bingham University College of Medicine, external vice president of Incision Nigeria, Africans healthcare student summit co-director. Hello, Mr. Otobo.
Hello, Mr. Fadi. Thanks for having me here.
Thank you, Mr. Otobo. Also welcome with Dr. John F. Bozuri, head of audio and visual in Incision Ghana, medical officer, Department of Surgery, Tamil Teaching Hospital, Ghana. Hello, Mr. John. Good evening. Mr. John, can you hear me? Okay, I think Mr. John cannot hear me. So let us proceed, starting with Ms. Jumana. Hello, Ms. Jumana. Good evening. Can you tell us about your organization and your work and your activities? And what are your aim and current plans in your organization?
First of all, hello everyone, and thank you for this great opportunity. I'm sorry for my camera settings; it's not working. And to start, about Incision Libya team, we are a group of medical doctors and medical students across the country who are, their aim is to gain knowledge and give advocacy about surgery and surgery-related procedures in Libya. And we started working on this goal by having two plans. First of all, by getting knowledge on our members, by having lectures to our members, by having boot camps, and then starting to focus on the highly used problems that we have in Libya. For example, we have a road traffic accident, which is a very high problem here. So on the World Trauma Day, we start posting pictures and we start posting posters about the effects of not wearing a safety procedures on this. And then we start doing, as previous doctor mentioned, that we lack the medical practice. So not only we have to increase awareness, but also we have to notice that we lack a medical practice. So we started conducting lectures by doctors and consultants, such as Dr. Khalid Aneba, who gave us a lecture about trauma healthcare management as an emergency procedure. And also he gave us lectures about orthopedics surgeons. And then we start to how we can implant a health information system to gain knowledge about documenting these data. And we have also a lecture about health informatics system in Libya. Then we start focusing, since we worked on the trauma, we've done a report about motor accidents in Libya, and we collected data and we've done a report about it. Also, we start working on our infrastructure by making our constitution and having a representative from all over universities here in Libya, or majority of them. Then the upcoming project for us we have to work on a research project. We start working on a research protocol about breast cancer, diagnosis and delay in outcome of it. We also want to increase our participation in such international events, such as today's forum. And also we are planning for more lectures to gain knowledge and to have more advocacy about surgery, so we can have an impact for that. And thank you for having us today.
Yeah, thank you very much,
Mrs. Jumana. That's a great job that you are doing regarding the global surgery. Thank you very much. Okay, now Mr. Abdullah Sayyid Hashi, good evening.
Good evening.
How are you?
I'm good, thank you. Thank you, all of you. I'm so glad that you are having me here.
Thank you, Mr. Hashi. In few words, can you tell us about your organization and your work and activities? In your opinion, how can students be more involved in global surgery? And what is your vision to the future partnership between the different organizations?
Hi, everyone. Good evening. And I'm Abdullah Sayyid Hashi in Institution Somali Jar, current. And I am postgraduate year 4 anesthesiology and reanimation in Mogadishu, Somalia. And firstly, if I give you a brief about Incision Somalia, the idea of Incision Somalia started in early 2018, but we joined the National Working Group in December 25, 2018. And firstly, after we start this program, then in our first job, we to get members and those who can participate our activity. And after this, we started our activity through our team. And first thing, we started in education, because education is a great part about global surgery. And then we arranged a seminar about pre and post-operative workshop in September 2019. Then we celebrate in October, we celebrate World Anesthesia and Trauma Day, and we bring more expertise surgeons in the panel and discuss about the surgery in Somalia. And also we take part a lot of activities, including in universal health coverage advocacy videos and more other videos in the as national working group in Somalia. And in 2020 early, we are planning to have a first global surgery symposium in Somalia. But unfortunately, the COVID-19 restrictions, we didn't do it. But in this year, we are planning to have again, inshallah. And the next question, and the students are the main force, the main task force about this program, because of they have more energy. They are eager to know. They are eager to learn about global surgery, and mostly in our team, and we educate ourselves, and we get seminars about global surgery from our seniors and our professors, and we are also talking about global surgery and because of its updating, its upgrading field, and so and sometimes we talk about our colleagues about global surgery and the importance of and advocacy. So we need we need a lot of, and we also need a lot of training, a lot of skills, and we are hungry about to learn more about global surgery. And so as our friends and our panelists said before, and the problem of about surgery, safe surgery, and is affecting everywhere. And also, and for example, if a patient from outside of the cities and needed surgical care, first he will pass about more steps. First, then he will take a traditional medicine. Then sometimes some places magic treatment, and then he will go primary health care. Finally, he starts going public and hospital with a late time, with a complication and with severity of the disease increasing. So we needed, as students, it's very important for us to advocate, to educate, and to do research, and to take part in collaborative researches around the world, and do more research in our country. In this year, in Somalia are are doing a big research about in COVID-19 and vaccination with our colleagues and our professors. And if so, everyone has right to do a research with. So students can do research, can learn about research, and so it's very important. So thank you, and again thank you again and Jazeera and Surgical Student Society for this great program, and I'm so glad to be with you. That's all. Thank you.
Thank you very much, Mr. Abdullah. That was very informative. Now we are going to Mr. Otobo Daniel. Hello, Mr. Otobo. Good evening.
Hello, good evening. Please, can you hear me?
Yes, we hear you very clearly. Mr. Otobo, please tell us briefly about your organization, your work, and your activities regarding global surgery in 3 minutes, please.
Okay, 3 minutes started. Okay, Incision Nigeria is a global social organization where a national working group of Incision Global, as you already know, with the first founders of Incision Nigeria. There's those who started it here, Dr. Aliu and Dr. Nelson. Now they are both very well advocates of global surgery. Incision Nigeria operates a national executive government style. There is an executive team made up of the chair, the co-chair, the vice president, and subcommittee leads. And then we also have other members. We have more than 100 national members. And Incision Nigeria basically takes global surgery very seriously, all aspects of global surgery advocacy. So to promote the ideas of global surgery, we have different subcommittees: the advocacy team, the education team, the research team, the idealization team, and each subcommittee has a subcommittee lead, and each subcommittee also has a subcommittee members. Now, each of these committees have different aims. For example, the advocacy team aims to spread the word about global surgery through online and in-person campaigns. The education team aims to contribute to the development of future generations in global surgery by holding webinars and education and seminars. The research team aims to map out global surgery around the world and in Nigeria and help us with a comparative perspective. Now, another very important role played by subcommittees, the idealization and programs team. Their job is to bring up the ideas to promote global surgery. Then they work with the other committees. Incision Nigeria, annually we hold different webinars, and we have members that represent us at international conferences of global surgery, come back and give reports. And this also helps us in our implementation and advocacy. Within Nigeria here, we have other surgical interest groups like Surgio, Incision, and we partner with these surgical interest groups. We don't only partner with surgical interest groups, we also partner with like other public health groups like the National Medical Students Team. We also partner with the Reproductive Health Team to carry out advocacy. This year, we've partnered with a group that carried out advocacy basically on liver cancers. Now, the perspective of the liver health regarding liver surgeries, abdominal general surgeries, Incision Nigeria joined them in this advocacy to advocate for, hey, global surgery is not just about hygienic surgeries. It also has to do with prevention of global, prevention of surgical burdens before it happens. So preventing liver cancers is also part of global surgery before you come to the theaters. We partnered with Incision Rwanda to hold a global surgical webinar on neurosurgery, an area that is very, very lacking in Africa. We've also partnered with other national groups here that had surgeons. We've partnered with invited surgeons in Nigeria and also outside Nigeria that are experts in global surgery. So currently, Incision Nigeria, which is more than 100 members, is trying to now, in the future, we're trying to penetrate each university in Nigeria to have like a university chapter of Incision Nigeria. in each university to promote global surgery in these universities. We aim to also create policies to promote global surgery, which will suggest to the medical board so that global surgery can be implemented, because in Nigeria, Incision Nigeria also in the future aims to put global surgery at the lip and at the doorstep of every medical student, so that it's no longer be a foreign concept. Like when Dr. Mashku was speaking, someone asked the question and said, this is the first time she's hearing about global surgery. And we have similar incidents in Nigeria when we make advocacies about global surgical programs and people reach out to us and say, hey, what is incision? What is global surgery? And then we are wondering, which do we answer first? So we want to, Incision Nigeria is trying to make global surgery, make people realize that global surgery is as important as public health and global health, show them what public health and global surgery means, and show them the importance of global surgery. Thank you so much.
Thank you very much, Mr. Otobo. Finally, good evening, Dr. John Buzuri. Hello? Dr. John? Can you hear me? Hello? Okay, I think Dr. John is not attended. Okay, that was very informative from all of you. Thank you very much, Mr. Jumana, Mr. Abdullah, Mr. Otobo, and Dr. John. Now I'm going to leave you with the closing ceremony, and good night, everyone.
So, hello everyone. I hope you are well and enjoying yourself. I am Saleh Muhammad. I am a third-year medical student in the University of Jazeera. I serve now as the head of Global Surgery and Outreach Cell in Jazeera Student Surgical Society, JES. So, before the closing ceremony, I would like to reintroduce you to Dr. Sireen, because she has a very important message for you. So, Dr. Sireen, if you hear me, please open your mic and share your video and tell us about your message.
Thank you, Dr. Saleh. Because of the time was running out, I couldn't speak more about the student rule, but I have a great opportunity for all of you. Because I'm working as the first Africa regional representative with Women Surgeons Organization, I have like a great opportunity I want to offer it for all of you, especially talking to female medical students, sorry, males. But if you want to start your own new chapter in your country in Africa, just feel free to direct message me on Twitter or my Gmail account. I will write it on chat. And also, I cannot speak more about women surgeons, but I'm gonna say that this organization supports female surgeons and female medical students with an interest in surgery. So thank you so much, Dr. Saleh.
So thank you all for joining us. I would like to warmly thank our amazing speakers who spoke in the first panel and the second panel, and of course, our keynote speaker. I would like to thank them. They have done a very great job. Also, I would like to thank our moderators who also done a great job facilitating the sessions. And of course, I would like to thank the participants for their attention and for their interaction. That was very amazing. So the key message from this event is that as important as global surgery is, the knowledge about global surgery is really scarce, especially in medical field students and even junior and senior doctors. And hence we have made this event to address this problem. Also, the gathering of such different organizations from different parts of Africa helps us as students to know where to go if we want to participate in global surgery, and help us to learn more from different outlets. This is so important. So please, I plead to all of you to follow every organization that have participating in this event, because you will learn too much from them and you will have the ability to participate in the coming events. The third thing is, as global surgery, the field of global surgery is currently growing. It's important for us all. As come together so we can learn together, and that will help form very strong. So as I was saying, joint event like this from different organizations help to form partnership between all of us, through which we can learn from each other and share our experiences. Also, this forms a very strong partnership that will help us when we come to our future projects. So again, I would like to thank you all, and I would like to encourage everyone who have participated in this event to work with us and to join us in the future event and stay happy and healthy. Thank you very much.